Hi, I'm Dr. Kristen Poe, functional health and naturopathic doctor, and I'm here today to talk a little bit about managing food intolerances during pregnancy. Managing food intolerances in and of themselves can be challenging, and adding pregnancy into the equation can pose additional challenges. So first and foremost, of course, pregnancy is a taxing time physiologically on the body. It is going through tons of hormonal shifts and different biochemical processes. The immune system is changing. There are food aversions and cravings. So it can make it challenging to distinguish pregnancy symptoms sometimes from food intolerance symptoms. So at the heart of managing food intolerances during pregnancy is first identifying them. We are so lucky that allergytest.co has state-of-the-art food intolerance testing, state-of-the-art labs and technology. They are cost effective, they are so easy and discreet to use. So first and foremost, getting the right testing done. Once those food intolerances are identified, of course, finding the correct food substitutes. So luckily, we have so many different food substitutes available to manage different intolerances. Of course, dairy, gluten, soy, and like preservatives, additives, food colorings are at the top of the list, especially during pregnancy. So once the intolerances are identified, finding suitable food substitutes that are available. And then one of the most crucial things in doing this is ensuring that when either eliminating certain foods or significantly limiting them, that adequate vitamin, mineral, and nutrient intake is happening, particularly during pregnancy, because the body is working double time. It's feeding for two. In my case, one of my pregnancies was feeding for three because I have twins. So it's really easy to get deficient in things because the body's demands are so high. So for instance, if somebody has a dairy intolerance, especially if it's like a newfound one that's happening due to some of the changes in pregnancy, it's very important to ensure that vitamin D and calcium and folic acid levels are met. So you're not eating dairy, so perhaps increasing your intake of leafy greens or fortified orange juice, and often supplementing with the right whole food supplements to ensure that those levels are adequate and not dropping. It's really important to ensure those are good, and of course working with your primary care physician, your OBGYN, a dietitian. Functional health provider can help you navigate through all of those things. And then to kind of piggyback off of that, being aware of labels, food labels, cross-contamination, and doing things like meal prepping at the beginning of the week to ensure meals are put together and paired efficiently so that adequate protein and vitamin and mineral intake is being taken in during this time during pregnancy. This should help one, keep a person healthy during their pregnancy, and two, to distinguish between pregnancy symptoms and intolerance symptoms. So those are just some quick, easy ways to manage food intolerances during pregnancy, which is already a wonderful but can be a challenging time as it is. With that said, have a wonderful day.